So I think the most important thing for us to get the attention of the political class in Nigeria is to reframe the narrative. We had so neck deep into the way we see things technically as medical experts in the country. So we want to tell them you should do 15% of the total budget. You should allocate it to health. We want to say, okay, data, this one, that one. We're very, very technical in our presentation. And it does not appeal that way to the everyday politician who intends to impress the people who he or she is ruling. Remember very carefully that you can spend so much on health services and it will be taken for granted as compared to when you build 30 kilometers of road, when you build one big infrastructure or the other, right? So we need to reframe it. How can we achieve universal health coverage? How can the achievement of universal health coverage help us to fix unemployment? How can the achievement of universal health coverage help us to fix insecurity? How can the achievement of universal health coverage help us to fix the social tension? How can achievement of universal health coverage help us to eradicate poverty? We need to find a way to frame it in such a way that the politicians and the common man will understand that healthcare should be at the front burner and should be priority as we go into the next government, into the next elections. So these are really key points that I would want us to take away from this summit. Beyond this, as Nigerians, we need to be very critical about the issue of health insurance, which will help us achieve that universal health coverage. Should it be voluntary or should it be mandatory? At this point, I think we should have mandatory health insurance, which will help us pay for the vulnerables, provide access, universal health coverage. We can, as a nation, come up to say every child under 5 and pregnant woman can have free healthcare services in our country.